sometimes it's very hard to tell how much medication a certain patient is going to need to be comfortable during a procedure. So if I'm stepping into a BBL and I find out that I have to inject a lot for that patient to be comfortable, I'm going to hit the ceiling of how much is safe to give them, and then I'm limited on what I can do based on patient comfort. So, newer thing coming out on social media and other places, of course, but the Awake BBL. So, people doing BBLs, just sedation with Valium, local anesthetic only, not taking it into a full-blown operating room, doing it in an office-based surgery center or just in their office, not a surgery center at all. And some patients are looking for this, number one, because it costs less, as you would imagine, because there's no facility or at least no anesthesia fee, because there's no anesthesia, anesthesia provider is going to be there. But some patients are talking about having decreased time for recovery and just being less scared of the process because they're kind of there for the whole thing. What are your thoughts on this? Is this something that you offer, would consider offering if people were talking to you about it?
Had you asked me this question even maybe a year ago, I would have said, heck no, I would never do this awake. But the more I think about, how I've been doing BBLs even under anesthesia over the last year, I'm always using ultrasound. And so I'm very careful. Every ounce of fat that I inject, I do put it deep, but I go above the fascia. And I think if we look at what were the concerns, in Florida and just nationwide with the deaths that were associated with fat embolism and BBLs, these patients are under anesthesia. And they were having all that fat injected into the gluteus muscle, which went into the veins and then to the heart, right? So I think when we think of the dangers of it, like why would we want to do it under full anesthesia? You have to ask yourself, and then why would we be okay doing it awake? So in my opinion, I think awake, it can be dangerous because the amount of lidocaine and tumescent you have to put into the patient to get enough fat to be able to inject into the butt, right? So I think that's one of the main concerns. And so you run into problems like lidocaine toxicity, patient not being numb, not being comfortable. You can sedate them, but that doesn't mean that they're not getting lidocaine overload, right? And then secondly is if you're doing it awake, are you putting it in the right layers of tissue? Now, if you can make sure you don't give them too much lidocaine and they're comfortable, and you can put it in a layer of the butt that they tolerate and it's not in the muscle, that's why I would say I may do it actually. Again, it depends on volume. I probably wouldn't do high volume BBLs, but I could see where there are scenarios now where patients are doing it awake, but in a controlled environment. I don't know if I'd be anytime soon doing these in my procedure rooms. We have plenty of space to do that. I just don't see myself doing it though. How about you?
Yeah, I think for me, my big time issue is when I do things under tumescent in the office, like say I'm just doing neck liposuction, you've got plenty of volume and plenty of lidocaine to give to numb somebody up. You will find that some patients take a ton and some patients take very little. And sometimes it's very hard to tell how much medication a certain patient is going to need to be comfortable during a procedure. So if I'm stepping into a BBL and I find out that I have to inject a lot for that patient to be comfortable, I'm going to hit the ceiling of how much is safe to give them, and then I'm limited on what I can do based on patient comfort. And I never want to step into a procedure, I'm already in the process of it, and figure out we're not going to get what we want today because I'm not in a space to keep you as comfortable as you need to be for the procedure that we have planned. It's like I don't want to finish and be like, okay, well, we got 100 cc's per side. You got the world's smallest BBL. You paid really good money for it. I guess like we should have been asleep. It's like I never want to have that happen during the procedure.
Yeah, and I love that. And I think that along with those lines, there's a certain level of results I think I like to get with these types of surgeries for patients, and I think that they are kind of expecting. I think when they say these super highly contoured, high definition, skin tightened patients with the BBL, and that all goes in conjunction in my mind. BBL is not just adding fat to the buttocks, but it's really framing the buttocks, it's contouring around it. We've learned about this through training and in our own practices. So I really feel like to get that result, to get that high level result, I don't think you can do that awake. Like I said, I think it's just uncomfortable. I don't think you can get them numb enough in all the places to get that result. And look, I do more lipo, and I'm sure you do a lot of lipo too, Sean, more than most surgeons out there. So this is coming from a perspective of, we do a ton of lipo, and I feel very comfortable doing it awake, but I don't think it's the safest thing to be doing these for patients in those high volumes.
Yeah, it's like, what's the point of having it done if your result is just going to be affected by the anesthetic you have chosen? And I get it. And a lot of these places that are coming up, these like Awake BBL places they're really kind of churning through. You see a lot of them in Miami. You're like, well, makes sense. It's like the world of the BBL. You also have a lot of patients that were like dying from large volume BBLs there, and patients they still want the result, but they're terrified of the surgery because of how many people have died in that state from BBLs. So they're like, well, if I do it awake and I have like a more subtle result, maybe that'll be a safer surgery for me. And I can understand the draw for that, but you're still undergoing the procedure, and then you may end up with a result that is so subtle that you're disappointed by what you're getting.
Yeah, totally.
So I don't know. No Awake BBL for me. I'll be asleep.
Yeah, I'm not planning it anytime soon.
Take it off.
Oh, you? Yeah, you're not getting. Yeah, you're just.
I'm gonna be asleep.
I wouldn't get one either away.
No, I'm gonna get Avali while I'm there to get my cellulite taken care of.
Yeah,
I get Renuvian so you can tighten the skin envelope and just peach it up.
Do it all. Exactly.
You're there. One stop shop. Yeah. Yeah. I actually had a patient recently that I did a BBL on while doing a mommy makeover, and did Avali and did Renuvian all at the same time. And it's like putting all of those together to get extra volume and get rid of cellulite and tighten the skin envelope at the same time is a very powerful thing. It's really nice to work all three of those together if you can.
Yeah, I mean, you're addressing all the three main issues, right? When we're assessing a buttocks, is like, one, is there dimpling or cellulite, which can only be addressed by the Avali or other similar devices. The volume, when you have mismatch of skin and buttock volume, that's where the fat grafting. And then the Renuvion is the skin tightening part because the skin's loose. So you address all three things. And so not only does it look better, it's more full, it's more perky, and the skin quality itself looks a little more smooth in leggings or whatever because you've done the Avali. So I agree. I think it's a great combination.
Yeah. And I think it's really nice to use fat grafting when you're doing the Avali as well, because when you're breaking up those bands of the cellulite, not just breaking it up and having those two edges be together where they could kind of reconnect, but putting fat into that space to make sure that they stay separate is a nice way to get a really nice result from the cellulite release.
Yeah, anytime I do Avali, I try to do that as well. I think it's a really good practice in my mind.